Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Matthew Glenn of Topeka about cauliflower ear. Thanks for being here today.
Thank you for having me.
What exactly is cauliflower ear?
Cauliflower ear is the end result of something called an auricular hematoma. An auricular hematoma is a collection of blood and fluid beneath the lining of the external ear or the pinna.
What are some of the symptoms?
Typical symptoms are onset after some trauma to the ear. The most common thing we would think of would be a wrestler that has their ear pinned or pulled. We get some shearing of the skin and the lining of the cartilage called the perichondrium, which tears some of the small blood vessels. We'll get leakage of fluid and blood beneath that perichondrium, and there'll be swelling or sort of a ballotable swollen area of the external ear. Once this happens, it's important to treat because the cartilage underneath gets all its blood supply and nutrients from that perichondrium and the blood supply above. So during the time that that fluid collection is present, the cartilage gets none of its normal blood supply and can undergo scarring and some new cartilage formation, which can result in the cauliflower ear.
How is it treated?
Typically, we like to treat these with incision and drainage. After we make a small incision and drain the fluid, we then need to provide some pressure dressing, and this can be applied through a type of head wrap which can be placed, or more commonly we'll actually place sutures through the ear and a material which will help hold that cartilage and perichondrium together, so therefore it can grow new blood vessels and get normal blood supply.
How do you know at what point to call the doctor?
Most of the time it's fairly self-explanatory, but unfortunately we still see people wait. Anytime you see an area that's swollen on that external ear, you should call.
Okay. Good information. Thanks for being here.
Thank you very much.
Please join us next week for a new health topic discussion on House Calls.